just moved into position as vice president of the Oncology Association of Naturopathic Physicians. So
congratulations.
yeah, so I'm really excited about that.
That's super exciting.
Yeah.
Was that something where you they have like elections every couple of years or something like
Yeah,
that?
exactly. So it's I believe it's a 1 or 2 year term. And so I was nominated to actually join the board, and then thereafter I moved into this VP role maybe about 2 weeks ago. So I'm really excited about the opportunity and working with really awesome colleagues. So it's really wonderful.
Yes. Great. Well, we have you coming on today. Thank you so much for joining us on the Wellness webinar, talking about breast cancer prevention and the role of naturopathic oncology. Give me 1 second. Sorry, let me actually talk with my nurse here. I think there was something a bit urgent, so let me just give me like 30 seconds.
I can pull up the poll while we are waiting. We wanted to just ask everybody, how are you doing today? So if you want to check in and answer the poll, it's just for fun.
Yep, no problem, no problem. We are in the clinic, so things happen, which is fine. But yeah, so we have
pulled up the poll.
Oh, thank you. How are you feeling today? Okay, I love that. Energized, happy, neutral, tired. We all have been through a lot with COVID. I hope everyone's staying healthy and well. It's good to see everyone on here, and thank you so much for attending today, by the way. Or not feeling my best. These are all possible choices. Was there another question after this, or?
Nope, that's it.
That's it. Okay. Actually, everyone's feeling either energetic, happy, or neutral, which is great. All right. Thank you for voting. And then we just wanted to say a couple kind of quick presentations. So Pancho, who's Araceli's rescue dog, has passed his intermediate training level. So on his way to become, I think it's beginner, intermediate, and advanced. So he is now intermediate level. I feel like this is like a ski slope, training, but this is rescue dogs. So he looks like a very erudite scholar there, is learning how to be a healer himself. So some extra biscuits for Pancho, I think, today. And Liz Reese is our amazing HeartMath instructor, and she is going to be continuing to do the HeartMath intro series. If you haven't done this yet, if you're listening, whether you're listening live or listening to the recording here, definitely check that out. They're group visits that are built to insurance, but it's how to manage the stress, how to manage the energy. We all know we can be more resilient at this time. This is Wednesdays from October 13th, 20th, and 27th. So every Wednesday from 4 to 5 p.m. with Liz. So that's going to be really great again. And then Araceli is just featured on our new episode, and Dr. Keats will have to get you on there as well very soon for our new Capital Integrative Health podcast. So we just launched that this month. It's still September. So Araceli and I have a really nice informal discussion about the connection between the gut and the brain, and how strengthening that connection and also managing stress will affect and strengthen that gut-brain connection and improve your health. So that is really a great podcast. Check that out there. It's just called Capital Integrative Health Podcast. Very easy to remember and listen to. And it's on, Jen, it's on the iTunes, I guess, right? And other places, YouTube.
Mm-hmm. Yeah, Apple Podcasts, which also iTunes kind of,
Okay,
and
Apple
Spotify,
Podcasts, okay.
And
Spotify.
YouTube, yeah.
Got it, thank you. We have a Facebook community now too, a private community that you're all invited to. If you're listening to this, you can just request to join that link at the bottom there. Please join our community. We're over 1,000 members now, really, that are in that community. We have a lot of health tips, a lot of great, I'm learning so much from that page, myself as well, ourselves here. So please join us there if you're on Facebook. And now for Dr. Keats. Dr. Keats is going to be talking again about breast cancer prevention and the role of naturopathic oncology. So I think that is the last slide for me here. I'm going to stop the share, and welcome again, Dr. Keats.
Thank you. I'm so happy to be here again this year to talk about breast cancer prevention. And I'm going to go ahead and share my slides here. Okay. I always have to move these boxes out of the way. Okay. Okay, so thank you everyone for attending. I'm going to be speaking about breast cancer prevention. As you may know, October is Breast Cancer Awareness Month, so getting an early start on this discussion, but I'm going to be speaking about breast cancer prevention and also the role of naturopathic oncology when it comes to breast cancer. And of course, at the end, I'm happy to take any questions that you might have. Okay, so first, what I'd like to do is just give a general kind of summary of naturopathic oncology. So the formal definition of naturopathic oncology is basically the application of naturopathic medicine or natural medicine to the field of cancer care and cancer treatment. And I am board certified in naturopathic oncology. There are maybe about 200 naturopathic doctors throughout the country who have this board certification. So there's not many of us, but we are around. And most of us that specialize in oncology care, we have this board certification. And so we focus on evidence-based medicine for management of cancer and also for prevention of cancer. And oftentimes we are collaborating with other providers. So for example, collaborating with medical oncologists or other conventional providers, or nutritionists, other providers that may be supporting the patients that we're working with. So when it comes to integrative oncology care, what I always share with patients is that it's important to use all the tools that you have available, especially when it comes to a cancer diagnosis. So why integrative oncology care? So basically combining the conventional medicine with the naturopathic medicine safely. And so it provides patients with this conventional aspect of care and with the natural medicine that helps to support patients through treatment. Now, the point of the natural therapies is to, of course, as I stated, to support patients through treatment by reducing side effects, but also implementing natural things that help to inhibit cancer growth, natural medicine that helps to optimize certain conventional care therapies. So for example, there may be certain nutrients, whether that's in the form of food or supplementation, that may enhance the effect of certain chemotherapy drugs or may enhance the effect of radiation, for example. And there's a great opportunity to use naturopathic oncology to prevent the risk of breast cancer recurrence or to reduce the risk of breast cancer coming back. Now, in the medical oncology kind of category, the main focus is around eradication of tumor, right? So that has its place, but the naturopathic care piece adds that really nice synergy and just kind of fills in the gaps. And so the ultimate goal with integrative oncology care is to support optimal health and well-being of our patients. And that means physically, of course, but also mentally and emotionally. All those aspects are very important. And by including conventional care and naturopathic oncology care, we're able to produce a nice, well-rounded plan of care for patients. Now, as far as evaluation and the clinical tools that are utilized in naturopathic oncology, of course, health intake or what the patient is reporting to us, right? So how they're feeling, past medical history, current diagnosis, sleeping patterns, all these important things. Of course, we're looking at laboratory testing, imaging studies. So whether that be a PET CT scan or an ultrasound or an X-ray or CT scan, pulling all that information together along with physical examination. Now, when it comes to the tools or the modalities that are used, definitely nutrition. I always say that nutrition is the foundation, and there's always an opportunity to use food as medicine. Botanical medicine or herbal medicine, right? Botanical medicine, herbal medicine, same thing. Supplementation, lifestyle counseling. Homeopathics can be very useful. So homeopathics can be effective, especially when it comes to mental and emotional health. It can also be helpful with things like pain management and even helping to support recovery following major surgeries. And then there's also the opportunity to refer patients for IV nutrient therapy. So I will often refer patients for intravenous vitamin C, for example, at CIH. Now, here, I just wanted to quickly review kind of the terrain kind of evaluation when it comes to breast cancer care. And this is, when it comes to breast cancer prevention and even in an actual active breast cancer kind of diagnosis. So vitamin D, as we all know, is so important for so many things: immune support, cardiovascular health, autoimmune health, brain health, cognitive support. But vitamin D is also very important when it comes to reducing the risk of breast cancer. And we'll talk about that a little bit later as well. It's also important to evaluate blood sugar modulation, especially when it comes to breast cancer. So when it comes to different cancer types, there are specific kinds of metabolic presentations, and blood sugar is a big one. So of course, fasting insulin is going to be important to monitor and control, along with hemoglobin A1C. That's going to be important to monitor and control when it comes to breast cancer prevention, and also looking at things like fasting insulin. Also, body fat percentage, especially when it comes to hormonal cancers like breast cancer, a greater body fat percentage has been associated with an increased risk of breast cancer. So keeping weight under control is going to be important. Of course, we want to look at the environmental kind of piece. So working to reduce toxic loads. So whether that be through foods that we're eating or through things that we're cleaning within our homes, things that we're applying to our bodies, we have to take all this into account, and we can test for these things if necessary. Hormonal evaluation. So we know that there's an association between estrogen and breast cancer, whether that's an hormone receptor breast cancer positive or whether it's a triple negative breast cancer. Modulating things like estrogens are going to be important. Also, I mentioned insulin as it relates to blood sugar. So that's going to be an important hormone to regulate as well, along with cortisol, which is associated with stress levels, right? So that hormonal piece is very important when it comes to breast cancer prevention. And then we also have to look at inflammation. And so inflammation is a big kind of buzzword nowadays. Inflammation, we know, is linked to pretty much any chronic condition that you can think of. And there's certainly a link between high inflammation levels and increased risk for breast cancer. So looking at things like C-reactive protein can be helpful. Looking at ferritin levels and some other markers can give us an idea of the level of inflammation. And if there are concerns around inflammation or if there are spikes in inflammation, there are things that we can do about it, right? So that's that in terms of that more specific kind of terrain evaluation when it comes to breast cancer. Now, in naturopathic oncology, there are specific goals, right? So in my practice, the first thing that I think about, especially for patients who are currently receiving treatment for breast cancer, or even for patients who have completed treatment with breast cancer, side effect management is very important because we want to do everything that we can do to optimize quality of life. So sometimes patients will have side effects that are lingering even after chemotherapy is done, for example. So certainly addressing those things are going to be important. Immune support. So immune support, cancer inhibiting support, that's going to be important for an active breast cancer diagnosis and even for prevention of breast cancer. We definitely want to enhance treatment outcomes. So like I mentioned, there may be certain nutrients in the form of food or supplementation that may have a synergistic effect with conventional treatment. So definitely keeping that in mind. And we want to do everything that we can to reduce the risk of breast cancer recurrence or breast cancer coming back for those who have a previous diagnosis. And then of course, we want to prevent breast cancer or reduce the risk of breast cancer as well. So those are the things that I'm thinking about as I'm working with patients. So when it comes to breast cancer statistics, breast cancer is the second most common cancer diagnosed in women in this country. That comes second to skin cancer. Now, we know that breast cancer impacts women more than men, but it does impact men, right? So 250,000 cases estimated per year, according to the Center of Disease Control for women, and 2,300 for men. So obviously the percentage is much different, but definitely something that we need to be aware of and pay attention to. Breast cancer is the leading cause of cancer death in women. That comes after lung cancer. Now, the positive is that deaths from breast cancer have declined over time, and we see this more so in postmenopausal women. Also, according to the American Cancer Society, there are about 3.5 million breast cancer survivors in the United States. So those are definitely positives around this diagnosis. Now, in terms of the improvements in those statistics, of course, we could attribute that to things like screening guidelines, improved awareness, and then also expansion of treatment options. So traditionally, we know that chemotherapy has always been an available option for cancer treatment. Radiation has been around for a long time as well, but now, in hormonal therapy too. But nowadays, we have targeted therapies like Herceptin, for example, which is targeted toward HER2 positive breast cancers. And then there's also a category of immunotherapies like Keytruda, for example, that's targeted toward more triple negative kinds of diagnoses. Now, the number one thing when it comes to prevention that I think of are just the basic kind of screening guidelines, right? So following those guidelines according to the American Cancer Society. So for women who are at average risk for breast cancer, and when I say average risk, that basically means that there is no personal history of breast cancer, there's no family history of breast cancer, there is no presence of genetic mutations like BRCA1 or BRCA2, for example. That's the average kind of risk. And for that population, the recommendation is to start with mammograms between 40 and 44 years of age. Between 45 and 54, that's when it should be consistent yearly kind of mammograms. And then as women get older, for example, 55 and older, that discussion or that decision should be made between the patient and the provider. So at that time, women can switch to having a mammogram every other year, or they can keep with the same schedule of having a mammogram every year. So for example, breast density, right? Breast density is associated with an increased risk of breast cancer. So if there's a woman that is 55 or older that has dense breast, then the recommendation may be to continue with yearly mammograms, for example. Now, for women who are at high risk for breast cancer, meaning, the things that I mentioned, there may be a BRCA1 or BRCA2 mutation, there may be a personal history of breast cancer, there may be a strong family history of breast cancer, especially those first-degree relatives. And in that case, sometimes MRIs are combined with mammograms. Also, for that population, MRIs and mammograms may be advised before 40 years of age. But of course, that discussion and that kind of conclusion is drawn between the patient and the provider. So what about the risk factors? So risk factors are those things that increase the risk, but definitely do not guarantee a diagnosis. So the first is the non-modifiable risk factors. So those things that, we don't have too much control over, right? But the good news is that there are modifiable things. So we do have some control, but these are the kind of things that we can't shift. So of course, breast cancer is diagnosed in women more so than men, right? We know that. As we age, the risk of breast cancer does increase. That BRCA1 and BRCA2, the mutations does increase the risk of breast cancer, ovarian cancer, and some others. That family history, especially for the first-degree relatives, is a risk factor. Personal history, as I mentioned, starting menstrual cycle early, menopause stopping later in life, and then again, having dense breasts does increase the risk of breast cancer. Now, when it comes to those modifiable risk factors, meaning these things can increase the risk, but we have control, right? We can change these things. So alcohol does increase the risk. And of course, it depends on how much you're taking in. So for example, one alcoholic drink per day is going to have a smaller risk compared to having 2 to 3 drinks a day. So just being really mindful about that. right? So reducing risk by either eliminating alcohol or by reducing the intake of alcohol can reduce our risk of breast cancer. Also, we have to think about, I mentioned earlier about body fat percentage, right? So we have to be mindful about weight, or being overweight, being obese certainly does increase the risk of breast cancer and many hormonal cancers like ovarian and prostate and some others. So we have to be mindful about that kind of thing. And according to the literature, the fat percentage or the obesity is more associated with menopausal women versus premenopausal. Not to say that it doesn't impact premenopausal women, but the percentages are different. And then lack of physical activity has been associated with an increased risk, especially in menopausal women. And this is probably associated with lack of physical activity being associated with obesity or being overweight. And so, when it comes to obesity or increased fat percentage, when you think about the kind of metabolic impact that has, it would make sense that it does increase the risk. So fat cells do produce estrogen, for example. So by having more fat cells, there's more estrogen kind of production. There's also increased levels of insulin, also increased levels of inflammatory markers, and all these kinds of cellular things that happen can certainly impact breast cancer risk. Okay, some other modifiable factors: birth control. So taking birth control pills or birth control devices in general can potentially increase the risk of breast cancer. Now, when it comes to the oral contraceptives, what they have found is that that risk may increase, but after stopping birth control, oral birth control, after stopping it over a number of years, that risk can potentially come back to normal. So in other words, it can be reversible. When it comes to hormone replacement therapy, we know that there is an increased risk there too, but similar to oral birth control, after you stop the hormone replacement therapy over a number of years, that risk can be reversible. So those are good things. Now, when it comes to the conventional let's say, approach to prevention, there's chemo prevention. And chemo prevention just means that a medication is being prescribed to prevent the risk of a disease in general. Now, when it comes to chemo prevention and breast cancer, those things are going to be applied for those patients at high risk for breast cancer. So again, the family history, the BRCA mutations, high risk, right? And so under those kinds of circumstances, the medications are going to be hormonal therapies for the most part. So those two kind of major categories are going to be selective estrogen receptor modulators, or SERMs. The most common one that we see is tamoxifen, right? And tamoxifen is usually recommended premenopausally. And then, of course, postmenopausally, you have the aromatase inhibitors like letrozole or anastrozole. Now, when it comes to surgery, there are prophylactic surgeries that are advised as well for patients who are at high risk. And so that may include something like a prophylactic vasectomy or a prophylactic oophorectomy, which is basically removal of the ovaries. Now, with that prophylactic oophorectomy, you'll see that more common in patients who have BRCA1 and BRCA2 mutations, because it does, as I mentioned earlier, increase the risk of ovarian cancer too. Now, the way that naturopathic medicine kind of fits into this picture is with the hormonal therapies, there are certain side effects that present. So for example, osteoporosis is a common side effect when it comes to the aromatase inhibitors. Joint pain can occur. Hot flashes are very common with tamoxifen and with the aromatase inhibitors. Sometimes women will experience shifts in blood sugar, meaning increased levels of fasting glucose or increased levels of lipids or cholesterol. So there's certainly natural things that I implement to help to counter these kinds of side effects. And of course, with any kind of surgical procedure, I'm thinking about preoperative support, I'm thinking about postoperative support, so that patients are able to recover quickly and so that pain is reduced. Okay, so what are some things that we can put into action right away? So the first thing, and probably the most important thing, and probably the most neglected thing, is sleep. So sleep hygiene is very important when it comes to reducing the risk of breast cancer. And, with sleep, there are a lot of important things that happen while we're asleep, right? There's cellular repair. It's a point where our bodies are able to detox. So it's very important that we're sleeping when we're supposed to sleep so that our bodies can do all these important things. Now, as it relates to sleep, melatonin is the major player when it comes to sleep hygiene. So while we're asleep in a dark, quiet room, that gives our bodies the best opportunity to secrete optimal levels of melatonin. Now, why is melatonin so important, especially as it relates to breast cancer? Well, it does help to enhance immune function. It acts as a really important antioxidant. Melatonin has an inverse relationship with reproductive hormones like estrogen. So, for example, when melatonin levels are high at night, as they're supposed to be, estrogen levels are low. So that balance is obviously going to be important when it comes to breast cancer prevention. Melatonin, especially when it's dosed therapeutically, can help to inhibit things like angiogenesis, which is a way to block blood flow to tumor cells. So there's an opportunity for melatonin to be effective when it comes to breast cancer prevention just by getting adequate sleep each night. And then it can also be dosed therapeutically in an active cancer diagnosis. So in order to have optimal levels of melatonin secreted, again, dark, quiet, cool room is very important, free of screens, right? No cell phone, television, etc. So when it comes to supporting sleep cycles, some of us would be happy to sleep at night, but some of us have trouble with falling asleep, sleep latency, or trouble with staying asleep. And so there are a lot of things that we can do in the natural medicine world to help to enhance sleep cycles. So of course, melatonin is definitely appropriate for many patients, low dose melatonin when it comes to setting those sleep and wake cycles. And depending on the specific presentation of insomnia, regular melatonin may be recommended, or perhaps sustained release, depending on what the issue is. Magnesium glycinate is a wonderful kind of relaxant, and most of us or many of us are actually deficient in magnesium. So a lot of times it's something that our body needs anyway, but definitely indicated when it comes to sleep disturbance. L-theanine is a wonderful amino acid that is extracted from green tea, and it acts as a relaxant as well. And so this is something that I like to recommend, especially for patients who have sleep disturbance due to anxiety, for example, or a busy mind, for example. It helps to impact neurotransmitters. And then for those patients who they don't want to take another pill, right? Epsom salt baths is a nice option. And the Epsom salts actually contain magnesium, which can be very relaxing. And so that's a nice kind of routine to have at bedtime to help to kind of get our bodies trained to go to bed at a timely hour. And then herbal teas. So herbal teas are very nice and relatively easy to get in during the evening hours. And the most common nervine teas that I like to use are things like passion flower, chamomile, and lemon balm. Now, you'll notice that herbs have, multiple kind of health advantages. So for example, something like chamomile and lemon balm, they act as great nervines or natural relaxants, but they also have an affinity for the gastrointestinal tract. So they can help with things like gas and bloating, and chamomile can be especially effective for gastrointestinal kind of inflammation as well. Now, valerian root is technically not a nervine, but a sedative herb. So this is something that's great to take in the evenings. It's actually something that I take at night. It is very smelly, but it can be very effective when it comes to helping to support sleep cycles. Now, oftentimes, patients will want to know, well, how long should I sleep for? Should it be 7 hours? Should it be 8 hours? Is more better? And so I just wanted to quickly review these next two studies just so that we have an idea of kind of what that sweet spot is. And so with this study, this was a meta-analysis. So they looked at a few different studies, 10 different studies, involved a lot of participants, over 400,000 participants, And they found that sleep duration of 9 hours or more was actually associated with an increased risk of breast cancer, especially estrogen receptor positive breast cancer. So in this case, more is not better, right? And so what is the reason for this? The exact mechanism is questionable, but potentially it may be related to inflammation. It may be related to dysregulation of cortisol levels or even having a negative impact on immune function. Now, in this next study, this study looked at, this was a prospective study, meaning that they followed patients over time, over 20,000 patients, over 23,000 patients. And they basically found that those who slept for 6 hours or less had an increased risk of developing breast cancer compared to those who slept for 7 hours each night. And so the general recommendation, and actually the recommendation made by the National Sleep Foundation, and I agree, is to try to sleep for 7 to 8 hours each night in a dark, quiet room, based on the data that we have. Okay, so when it comes to nutrition, I mentioned earlier that there's always an opportunity to use food as medicine. And I don't have this on a slide, but I did want to mention, some of you may get very excited about this, but there was a study published in August of this year that actually showed that coffee, 2 to 3 cups of coffee per day, that was associated with a reduced risk of breast cancer mortality, probably due to the antioxidants in coffee. And so, of course, when we're doing coffee, we always want to make sure that it's organic, because otherwise it is packed pretty heavily with pesticides. But anyway, I wanted to share that tidbit before we kind of move forward here. Okay, so when it comes to food, of course, what we eat is very important, but food timing is very important too. And with this study here, what it showed is that intermittent fasting is a great prescription, definitely an indicated prescription when it comes to reducing the risk of breast cancer recurrence and also reducing the risk of breast cancer mortality. And they saw this primarily in the group that fasted overnight for 13 hours or more. And so what I typically tell my patients is that, for example, if you're having your dinner at 8 o'clock at night, make sure not to have breakfast before 9 a.m. in the morning. That is a prescription in itself when it comes to reducing the risk of breast cancer recurrence and reducing the risk of breast cancer mortality. That probably has to do with blood sugar. They were able to measure hemoglobin A1C, and they found that the patients who were fasting overnight for 13 hours or more, their levels were lower. And it may also have to do with improved kind of sleep hygiene and that exposure to melatonin and all those other kind of important things. Now, another point when it comes to timing of meals, this was a study that was done, published in 2018 in Barcelona Institute for Global Health. And they found that it's important to have your last meal or snack at least 2 hours before bedtime, right? So that was associated with a reduced risk of not only breast cancer, but also prostate cancer too. So even if you are intermittent fasting for 13 hours or more, it's very important that you have that cushion between your last meal and your last snack and bedtime. So when it comes to specific kinds of foods, of course, we know that fruits and vegetables are super important. And so this is kind of the data to support that. So this study here, this first one here, looked at a lot of people, analysis of 18 different studies, and meta-analysis involved 1 million women. And they basically found that carotenoids found in our fruits and our vegetables were linked to a reduced risk of estrogen receptor negative breast cancers. And as you may know, hormone receptor negative breast cancers tend to behave more aggressively. So that's great to find data to support that specific kind of diagnosis. They also found in a different study that dietary alpha carotene, beta carotene, and lycopene, which falls underneath that carotenoid kind of umbrella, was associated with ER positive and PR positive breast cancer. So, taking in these carotenoids is going to be important for prevention of negative or positive breast cancer risk. Okay, now this next study here, it looked at fruits and it looked at vegetables, but it especially looked at the cruciferous family, which is probably the most studied vegetable family when it comes to cancer prevention and even cancer fighting support. And they also looked at that yellow-orange vegetable family, which is really primarily those carotenoids. And again, there's an association here with a reduced risk of aggressive tumors, which are often those triple negative kind of breast cancer diagnoses. And this last meta-analysis that I'll reference here, they followed patients over time and they found that high intake of fruits and then also fruits and vegetables combined was associated with a reduced risk of breast cancer. So, making sure that we're getting a rainbow array of fruits and vegetables into our diet, but especially the carotenoids and that cruciferous family is going to be really important. So again, rainbow diet. And the different colors have different kinds of health advantages, right? So immune support, reducing inflammation. We know that by reducing inflammation, that reduces our risk of breast cancer and so many other health conditions. Some of these nutrients, especially the cruciferous family, helps to support liver detoxification. And, a lot of these things, of course, have cancer inhibiting effects as well. So I've listed some cruciferous vegetables there. I've listed some carotenoids there. The other benefit, more specific benefit when it comes to the cruciferous family of vegetables is that it helps to support favorable kind of metabolism of estrogens. So definitely a very important family to implement on a regular basis. Okay, and here just emphasizing those alpha carotenes, beta carotenes, and lycopenes, which fall underneath that carotenoid kind of umbrella. Now, I want to, and I think that my slides may be shared afterwards, but I wanted to include one of my favorite recipes here, which is a cauliflower cilantro watercress soup. So very simple recipe and super healthy. So you have the cauliflower from the cruciferous family, you have the watercress from the cruciferous family, and cilantro, which is a great liver detoxifier. Try this recipe, very good. Okay, now the Mediterranean diet. So, that includes fruits and vegetables, again, nuts, seeds, extra virgin olive oil, low intake of animal-based proteins, especially red meat, some poultry, definitely clean seafood. Now, this type of diet, Mediterranean diet, has been associated with a reduced risk of breast cancer. And this is found in premenopausal women and also in postmenopausal women. So a lot of questions come up about what kind of diet should I follow? Should I do keto diet? Should I do meat? Should I remove meat? But I really like the idea of, for most patients, recommending a Mediterranean diet, whether we're talking about an active diagnosis or prevention. Okay, now when it comes to supplementation, that umbrella is pretty wide. There's so many different options, right? So that can be vitamins, minerals, antioxidants, herbal supplements, and it's really individualized and based on the patient and what we're addressing. But I would have to say that the most common recommendation that I make is vitamin D. So I mentioned in the beginning, there's definitely an association with reduced vitamin D levels and increased risk of breast cancer and increased risk of so many different cancer types. So having vitamin D levels checked on a regular basis, depending on the patient, that may be every 6 months, that may be once a year, then making sure that we're having our levels checked on a regular basis to ensure that we are being dosed appropriately with the right amount of vitamin D. Of course, we can have an increase in vitamin D levels from sun exposure, but most of us also need the supplementation as well. So the last thing that I'll emphasize here is exercise. So overall studies show that regular exercise lowers breast cancer risk by 10 to 20%. And this benefit is seen most clearly in postmenopausal women, again. So making sure that we're exercising on a regular basis is going to be important for prevention. And this is a study that was published in 2017. And what they did was they looked at a number of different kind of lifestyle factors. And they found that physical activity or exercise was found to have the most robust effect when it came to breast cancer prevention. So making sure, of course, that you're sleeping and you're eating right, and stress management and all these important things, regular laboratory kind of evaluation, but really prioritizing exercise and physical activity is going to be very important. And why? So the proposed kind of mechanisms as it relates to breast cancer prevention would be exercise can help to lower the levels of endogenous hormones, right? So lowering the levels of estrogens, helping to improve blood sugar regulation, because when blood sugar is elevated and insulin becomes elevated, insulin can certainly act as a stimulator to breast cancer cell growth. And of course, reducing inflammation is something that we always want to do. Now, patients will often ask, well, how much exercise should I put in each week? What should I do? And so according to the American and the Canadian societies, the American and Canadian Cancer Societies, the recommendation is to do 150 minutes of moderate exercise per week or 75 minutes of vigorous exercise per week. And what also should be included in that regimen, it's strength training 2 to 3 times a week. So that's the general recommendation there. Okay, so in conclusion, implementing healthy habits empowers us to achieve improved wellness, reduces the risk of breast cancer and other chronic conditions as well. I thank you so much for your attention today, and I'm happy to take any questions that you have.
Thanks, Amina. Thank you so much. Great presentation as usual. I had one question on melatonin. How do you dose that there?
For cancer treatment?
I guess immune boosting. What would your recommendation be?
Yeah.
And then also if someone has a cancer diagnosis.
Yeah. So, gosh, these shades, sorry. So when it comes to a cancer diagnosis or a breast cancer diagnosis, I usually start lower at 10 milligrams, because some patients will report grogginess with a higher dose, like 20 milligrams, for example. So I usually start lower at 10 and then boost up to 20, sometimes 30. But usually we Okay. Yeah, no foods that should be avoided necessarily with tamoxifen, but definitely supplements that should be avoided. In terms of flax seed, not oil, but flax seed, there's actually studies showing that it may have a synergistic effect with tamoxifen. So adding flax seed to a smoothie or to a plant-based yogurt would be something that would be therapeutic.
And then I have a question on vitamin D. I know that, vitamin D is one of those vitamins that we're always checking, with patients. What are your target ranges for vitamin D for a general population, and if it's any different for a patient who might have cancer?
Yeah, it's the same from my perspective for an active diagnosis or not. And that would be, I'd like to see it around 80, between 70 and 80. And most people are not that high. So most of the time I am dosing, but definitely between 70 and 80.
Yeah, I think it's hard to get to that level without really spending a significant amount of time outside or supplementation.
Yeah, definitely. Definitely.
And then I think it might be worth talking about here, since I know I get this question a lot, is what do you think about thermography, and thermography versus mammogram and things like that as a tool to maybe detect breast inflammation?
Yeah. So, so I definitely Well, I'm not a fan of doing thermography exclusively. I think that it's wiser to do a mammogram and thermography at the same time, maybe to get a baseline, and then moving forward with thermography thereafter. Just because in terms of research, kind of comparing the two, there's just not enough, to say that we can use this exclusively for screening. But I would say having that the baseline of both of them and then moving forward is something that I think would be more advisable. I definitely understand the concern about reduced exposure to radiation.
Do you advise your patients to get thermography in conjunction with mammogram, or is it kind of depending on kind of their goals and things like that?
Yeah, it's more dependent on kind of what the patient is expressing. Usually I recommend kind of the standard, but if there's a patient that may be concerned about radiation exposure, or maybe that has a history of radiation exposure, maybe perhaps from work environment or previous kind of cancer diagnosis, and then we may talk about that.
Yeah.
The other thing is that mammograms are typically not ordered that often, so if anything, they're not ordered more than once in a year. So there's that too,
Mm-hmm.
in terms of the concern.
Yeah, yeah. So I think there's a lot of research on nutrition and breast cancer risk, or nutrition for different once if someone gets a diagnosis, let's say of breast cancer. Is there any change in the nutritional recommendations when someone might be looking for, again, breast cancer prevention versus if someone has treatment, or any changes there in general, I guess?
Yeah. So, I would say in general, the recommendations are pretty similar. Probably they might change with the active diagnosis if there is progressive disease, or if the biomarkers, or if the lab work has shown some concerns. There may be things that we tweak based on that information, but I would say the general.
And this is just a question I was wondering, but what do you think about dairy in the context of a healthy diet in relation to the risk of breast cancer?
I don't like it.
You don't like it? Okay.
But some of us are connected to certain foods, right? And so, for patients who may have difficulty with giving up yogurt or ice cream like me, or cheese, if anything, do it sparingly. And when you do it, make sure that it's organic. But ideally, I would say to eliminate it, just because of the inflammatory nature.
Mm-hmm. Because dairy increases IGF-1 and things like that?
Yeah, exactly. IGF-1, the potential to enhance inflammation. And then also kind of from a hormonal aspect, I think there's caution around that too, because even if you are getting organic, there's still some level of hormones there too. So yeah, but my main concern around it is the inflammatory nature of dairy.
Mm-hmm. Mm-hmm. Okay, got it. So if you do drink milk, have it with some cruciferous vegetables, maybe a cup of cruciferous.
Yeah, or why not sprinkle some turmeric in there?
Golden milk.
Yeah,
right?
you got it.
Yeah.
Golden. Yep.
Yeah.
Exactly.
Or I think it can be used also golden milk with almond milk too, right?
Yeah, absolutely. Or coconut milk.
Coconut milk.
To enhance the absorption of the turmeric. Absolutely.
Yeah.
That's definitely some options there. I find that a lot of times, it seems like people are moving away from cow's milk. It feels like a lot of people are doing the plant-based milks these days.
Mm-hmm. Yeah, exactly.
Yeah.
And I know you talked about some of the root causes of breast cancer, one of them being environmental toxins. Curious about your thoughts about, are there specific toxins that are kind of more, I don't know, dangerous or more significant here for breast cancer prevention, let's say, or even treatment?
Yeah. So, the things that stand out to me are plastics, right? So, when I say plastics, I think BPA. So, avoiding plastics, especially reusable kind of plastics like water, disposable water bottles or kind of beverage bottles. and doing water filters instead. So minimizing plastic use is going to be important. When it comes to, foods that we eat, organic is something that I always recommend. And then also, glyphosate. There's a lot of, talk about glyphosate, and it has been for some time, more so associated with lymphomas, I believe, but, definitely some impact there when it comes to other cancers too. And, prioritizing organic foods can reduce our intake to glyphosate to some extent.
And I was reading about glyphosate, and there's been studies that show that essentially glyphosate is found in many conventional foods, not just wheat.
Yeah.
So part of eating organic ideally would be obviously avoiding pesticides, but especially the glyphosate, which is so bad for the gut microbiome.
I know. Yeah, the legumes, the grains. Yeah, definitely. And even when we're doing organic, there's some level of
There's
it,
some crossover, yeah, but you're
but it's
basically,
less.
eating like an amazing, Mediterranean diet and all this stuff, but then if there's the glyphosate in there, it might be washing away some of that benefit.
Yeah. And then you can do some liver detox, once or twice a year too. So, there's ways to counter kind of these environmental toxins.
Got it. Well, thank you so much, Dr. Keats, Ermina. Great to have you on here. We're doing the wellness webinars once a month. Definitely let Jen and I know what you would like to, hear here as well. And yeah, I'd love to have you on for the podcast as well.
Oh yeah, that'd be awesome.
Yes, it's been a lot of fun. Thank you, Rachel, for the comment. Good to see everyone here. Hope you're staying healthy. Remember to, partly buying organic is about, cultivating and improving your own health, but it's also about improving the health of the earth, which we all live on. We're kind of dealing with a lot of things now with the earth, climate change, wildfires, all these things. So all of our actions, in some collectively may make a bigger difference in the long run, as a community. Michelle says, thank you. This is wildly informative. Thank you and congratulations on your position.
Oh, thank you. Thanks very much.
And Stephanie says, thank you. So helpful. All right. Well, it is 1 o'clock and we have to go, but we'll see you next month. And thank you so much again, Dr. Keats. Talk to you very soon.
Okay, take care. Bye-bye.
Bye.